Only 1% of people know all the effects that creatine really causes in your body after 50. Creatine is the most rapidly growing supplement in the world. More recently, it has also made its way into the medicine cabinets of older adults. But does it really deserve all this recent excitement? Or is it an overhyped supplement that only gets so much attention because it generates high profits? Well, to answer that question, we need to analyze the reactions it can cause in your body. That is why today you will learn about the 10 main reactions that creatine produces. Stay with us until the end, because this is an unbiased analysis and we will not recommend any brand, nor are we affiliated with any. The greatest proof of that is the fact that we will address possible negative reactions already reported with this supplement, because the industry that only aims for maximum profit will never mention those, right? Before we begin, please leave a comment with your name and the city where you are watching our content. We would love to know. Reaction number 1, possible gastrointestinal discomfort. Let us start by talking about something that does not always appear in videos that only praise creatine, but that is important for you to know after the age of 50, when the digestive system tends to become more sensitive. Some users report stomach discomfort, abdominal bloating, or mild episodes of diarrhea during the first days of use. This usually happens when a large dose is taken all at once, especially during the old loading phase that some labels still recommend, but which is no longer considered necessary by most researchers in the field. The reason for this discomfort is related to the amount of creatine that remains unabsorbed in the intestine, drawing water into the digestive tract. Practitioners who choose smaller doses, spread throughout the day, report far fewer problems of this kind. A practical tip is to always take creatine with a meal, which helps slow down the absorption rate and softens the impact on the stomach. Choosing the micronized version also tends to make digestion easier, since the particles are smaller and dissolve more readily in water. Drinking plenty of fluids throughout the day is another factor that considerably reduces this reaction. It is worth noting that this discomfort, when it occurs, tends to be temporary and disappears as the body adapts to the supplement. If symptoms persist for many days or become intense, the ideal course of action is to stop using it and speak with a doctor, especially if you already have a pre-existing digestive condition such as irritable bowel syndrome or chronic gastritis. Cases in which introducing creatine must be done with even greater caution. Reaction number 2, possible subcutaneous water retention at the beginning. This is one of the most talked about reactions and also one of the most misunderstood. During the first weeks of use, it is common to notice a small increase on the scale and a feeling of bloating, especially around the abdomen and face. This happens because creatine draws water into the muscle cells, increasing intracellular volume. For a long time, it was believed that this retention also occurred subcutaneously, meaning just beneath the skin, which would create a puffier and less defined appearance. More recent studies, however, show that this retention occurs mainly inside the muscle rather than under the skin, which means the negative aesthetic effect tends to be much smaller than its reputation suggests. After 2 to 4 weeks, the body tends to regulate itself, and this feeling of bloating practically disappears for most people. After the age of 50, as body composition already tends to change naturally, some men and women notice this retention more noticeably at the beginning. But this does not indicate any health problem, only a temporary adaptation. To minimize this effect, avoid the loading phase with very high doses, and prefer a moderate, consistent daily dose from the very first day. Maintaining good hydration also helps the body regulate this process more quickly. If you participate in a sport that depends on weight categories or have very specific aesthetic concerns, it is worth speaking with a professional before starting supplementation in order to plan the ideal time to begin. Reaction number 3, improvement in mental health and cognitive function. Here's one of the most surprising reactions for those who only know creatine from its aesthetic side. The brain, just like the muscles, also uses phosphocreatine as a quick energy source. And as we age, this cerebral energy reserve tends to decrease naturally. Research published in scientific journals has shown that creatine supplementation can improve short-term memory and reasoning in situations of sleep deprivation or mental fatigue, effects that become even more relevant after the age of 50. A study conducted with older adults observed significant improvement in memory tests after a few weeks of regular supplementation. What many people do not know is that this cognitive improvement seems to be linked to the greater availability of energy for neurons, which are able to recover more quickly from periods of intense mental effort. Regular practitioners report a feeling of greater mental clarity and fewer episodes of brain fog throughout the day. It is worth highlighting that cognitive effects tend to be more evident in people who already have a natural creatine deficiency in their system, such as vegetarians and vegans, a point we will return to later in this video. To obtain this benefit, No special protocol is needed beyond the standard daily dose already recommended for muscular effects, which makes this benefit practically a bonus for those who already supplement with only their body in mind. Reaction number 4. Improvement in cardiovascular health. Creatine also appears to play an interesting role in the cardiovascular system, something that is rarely discussed outside academic circles. The heart is a muscle that works continuously and relies heavily on the phosphocreatine energy system to maintain its steady rhythm. As we age, this energy availability tends to decline, which can compromise cardiac efficiency over the years. Some studies suggest that supplementation may contribute to the reduction of markers related to cholesterol and triglycerides, although the exact mechanisms are still being investigated by science. Another observed point is the possible improvement in endothelial function, which is the ability of blood vessels to dilate properly, supporting more efficient circulation. This does not mean that creatine replaces a heart-healthy lifestyle, which includes a balanced diet and regular aerobic exercise, but rather that it can serve as an interesting complement within an already structured routine. For people after the age of 50 who naturally face a higher cardiovascular risk, this is a point that deserves attention and, most importantly, regular medical follow-up with periodic exams evaluating the lipid profile and blood pressure. People with a history of serious heart disease should always speak with their cardiologist before starting any supplementation, including creatine, to ensure there are no specific contraindications for their individual case. Reaction number 5. Increase in bone density. After the age of 50, loss of bone density becomes a real concern, especially for women in the postmenopausal period, when the drop in estrogen levels accelerates this process. Creatine enters this picture in a little-known but relevant way. By improving the ability to perform strength exercises with greater intensity and faster recovery, it contributes indirectly to the mechanical stimulus needed for maintaining and strengthening bones. In addition, some research points to a possible direct effect of creatine on the cells responsible for bone formation, the osteoblast, although this mechanism still needs more studies to be fully understood. What is already known more clearly is that the combination of creatine supplementation and regular strength training produces superior results for bone health compared to strength training alone. This is particularly important for preventing osteoporosis and reducing the risk of fractures, one of the leading causes of loss of independence in older adults. Regular practitioners who combine these two factors report a greater sense of physical solidity over the years. If you already have a diagnosis of osteoporosis or a family history of the condition, it is worth speaking with your doctor about how to structure a program that combines supplementation and exercise in a safe and progressive way, always respecting your individual limits. Reaction number 6. Benefits for vegetarian and vegan diets. This is a point that often goes unnoticed but makes all the difference for a growing portion of the population. Creatine is found naturally in animal-based foods such as red meat and fish, which means that vegetarians and vegans tend to have naturally lower levels of this compound in their bodies. This is not necessarily a serious problem in daily life, but it can be reflected in lower physical performance and, as we saw earlier, also in lower cerebral energy reserves. For this reason, studies show that vegetarians and vegans tend to show even more significant responses to creatine supplementation than people who already consume meat regularly, since the starting point tends to be lower, leaving more room for improvement. After the age of 50, when preserving muscle mass and cognitive function becomes a priority, this benefit becomes even more relevant for those who follow this type of diet. The good news is that the creatine used in most supplements is produced synthetically in a laboratory, which makes it completely compatible with vegetarian and vegan diets without any ethical or nutritional conflict. It is always worth checking the product label to confirm vegan certification, since some manufacturing processes may involve animal-derived ingredients at specific stages. For those who follow this dietary lifestyle, supplementation can be seen as a practical way to fill a natural nutritional gap in the diet. Reaction number 7. Improvement in strength and muscle recovery. We have reached the most well-known reason why creatine became so popular, and it is no coincidence that it is considered the most studied and scientifically proven supplement in the fitness world. Its main mechanism of action involves increasing the availability of phosphocreatine in muscle cells, which allows for faster regeneration of adenosine triphosphate, the main energy currency of the body during short, intense efforts. In practice, this translates into more strength to perform additional repetitions and more efficient recovery between training sets. A meta-analysis that brought together dozens of studies found significantly greater strength gains in groups that supplemented with creatine compared to groups that trained without the supplement, even while following the same exercise program. After the age of 50, this benefit becomes even more valuable since the natural loss of strength and muscle mass, known as sarcopenia, accelerates with the passing years and represents one of the leading causes of reduced quality of life in older adults. Regular practitioners report a feeling of greater energy to complete an entire workout without that sharp drop in energy during the last sets. In addition, creatine appears to reduce markers of muscle damage after exercise, which supports faster recovery between training sessions, allowing for greater consistency over the weeks, an essential factor for those seeking lasting results safely. Reaction number 8. Effects on the kidneys. This is probably the strongest and most repeated myth about creatine, and for that reason, it deserves a careful explanation. For years, the idea spread that creatine supplementation would cause kidney damage, mainly because it can slightly elevate creatinine levels in the blood, a marker commonly used to assess kidney function. However, it is important to understand that this increase in creatinine does not necessarily represent actual damage, but rather a natural byproduct of creatine metabolism, which can confuse routine lab results if the doctor is unaware that the patient is using the supplement. The vast majority of studies conducted in healthy individuals, including some with long-term follow-up, found no evidence of real damage to kidney function associated with proper creatine use. Even so, it is essential that people with a history of pre-existing kidney disease, uncontrolled high blood pressure, or diabetes with kidney complications speak with their doctor before starting supplementation, since these specific groups still lack more robust long-term safety studies. After the age of 50, when routine exams become more frequent, the ideal approach is to always inform your doctor that you use creatine, so that they can correctly interpret creatinine results and avoid mistaken conclusions. Maintaining good hydration and respecting the recommended dosage remains the safest way to use the supplement without unnecessary concerns. Reaction number 9. Prevention of muscle aging. From the age of 30 onward, the human body begins to lose muscle mass gradually, a process that accelerates significantly after 50, especially if there is no regular stimulus from strength training. This loss, as we mentioned, is called sarcopenia and is directly related to falls, fractures, and the loss of functional independence in older adults. Creatine acts as an important ally in this scenario, not only by improving performance during training, but also by supporting muscle protein synthesis, an essential process for maintaining and rebuilding muscle tissue over the years. Studies with older adults show that the combination of creatine supplementation and resistance strength training preserves significantly more muscle mass than training alone, which reinforces the importance of combining both factors rather than relying on just one. Beyond the direct gain in strength, this muscle preservation contributes to a more active metabolism, since muscle tissue burns more energy at rest than fat tissue. This means that keeping muscle mass preserved after the age of 50 also helps with body weight management over time. Regular practitioners who maintain consistency in both training and supplementation report greater ease in performing everyday activities such as climbing stairs or carrying objects, which demonstrates the direct impact of this benefit on quality of life. Reaction number 10. Elevation of liver enzymes. Just as happened with the kidneys, the liver also tends to be the target of concerns related to creatine use, mainly because blood tests may show a slight elevation in liver enzymes such as alanine aminotransferase and aspartate aminotransferase in some people who start supplementation. It is important to highlight that in the vast majority of studied cases, this elevation is mild, temporary, and does not indicate real damage to the liver, being interpreted by many researchers as an adaptive response of the body to the new compound being metabolized. The liver, in fact, is the organ responsible for part of the natural production of creatine in the body, along with the kidneys and the pancreas, which explains why it may show some initial response to the increase in external intake of this compound. People with a history of pre-existing liver disease should pay close attention and seek medical guidance before starting any supplementation, including periodic follow-up exams. For most healthy people after the age of 50, however, the studies available to date do not demonstrate an association between proper creatine use within recommended doses, and any form of significant long-term liver damage. As always, keeping medical appointments up to date and performing routine exams is the safest way to monitor your overall health, with or without the use of supplements. Now that you already know the 10 main reactions, let us move on to the bonus that closes this topic on a high note. Bonus reaction: reduction of fatigue and improvement in mood. To close this analysis with an effect that directly impacts your daily routine, let us talk about the relationship between creatine and the feeling of fatigue throughout the day. As we have already explained, phosphocreatine is a quick energy source used not only by the muscles but also by the brain. And this energy availability has a direct relationship with the mental and physical tiredness we feel, especially on busier days or after poorly rested nights. Some studies observe that people supplemented with creatine reported lower perceived effort and fatigue during demanding cognitive tasks, as well as improvement on mood-related scales, especially in contexts of sleep deprivation. This seems to be connected to the greater energy efficiency of brain cells, which are able to recover more quickly from peaks of mental demand. After the age of 50, when sleep is often no longer as restorative as it was in youth, this effect can represent a noticeable difference in the energy available for daily activities. It is worth highlighting that creatine should not be seen as a substitute for a good night of sleep or healthy habit. What many people do not know is that this benefit tends to be one of the first to be noticed, often even before visible gains in strength or muscle mass, functioning almost as an early indicator that the supplement is taking effect in the body. Now that you know exactly everything that creatine can do to your body, if you choose to take it, be careful not to make the main mistakes that many people make with this supplement, which throws its potential away and can even cause harm to your body. If you want to know what those mistakes are so you can avoid them, we have a video appearing right now that goes over each one of them in detail. It is free knowledge, so make sure you check it out. Thank you for watching until the end, and may God bless you, my friend.